Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham. We're a team meeting discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet. And today it's just going to be us talking about how insurance billing in healthcare makes it more expensive. So, Janet, I'll go ahead and let you get started as I wrap up some technology.
Okay, so what we have to remember is in healthcare, we think as the patient that we are the consumer. We should be the consumer of the service or the products. However, the reality is that it's really driven by the insurance company. So it's a third party player that is in between you and your provider, your doctor and physician, and so they end up determining what is covered, what they are willing to pay for or not pay for. So it's not like we think it is. We think it's like when we go to purchase another commodity from like the grocery store, there's nobody in between you and the clerk or the store. But that's not what happens in healthcare. Um, there is an incentive by insurance companies to drive coverage in a certain direction, and that's what happens. And so, unfortunately, the consumer or the patient is not the person that is really being heard. It's being driven by what an insurance company will pay. So, if you are in the insurance model or that where you are, going in and the insurance company is paying for your visit or your surgery or your procedure, um, you're not really being heard. What's being heard is how much that insurance company is going to pay. However, if you stepped out of that model and you went into the cash or you are the consumer, for example, I will throw out the surgical center of Oklahoma, where there's surgical centers that are cash only. You're the consumer. They give you a price, you pay up front, end of story.
Yeah, it's all about when you're a consumer, you're the one driving the service, the cost, and the quality.
Right.
And when you're not paying the bill, i.e., when you're letting insurance pay the bill, they're the ones driving that. Well, they want to, they really, all they care about is they care about costs. That's really all they care about because it's not them as the individual that's getting the service or the quality. So we can give many examples. I'll use the Surgery Center of Oklahoma as an example of what makes healthcare expensive, of how insurance makes healthcare expensive. So my son in 2020, he was 18 years old doing things that 18-year-old boys do, and he was jumping a canal on his feet, running across and jumping the canal. One of his friends had just done it, and so he was going to do it also. And the last second, my oldest son yelled something at him, and so he hesitated. Well, as you can imagine, he came up short and he hit a concrete barrier with his left tibia. So he had a left tibia compound fracture. And we went to the local hospital here. I tried to do everything we could to not do that because I don't like going to hospitals, um, you know, for reasons of quality, lack of service, and lack of transparent pricing and expensive. But it was a compound fracture. It was sticking out of his leg, so we had to do something about it. I was out of town. Janet elected to have him go in and do surgery, which was the right decision. And in all fairness, the surgery went very well. He was out in 12 hours. It was the middle of COVID. That part didn't go very well. But Janet, as a mother, didn't let them stop her from being in the room from her 18-year-old son, which just reminds me of never, ever let your loved ones be in a hospital alone. No matter what they tell you, don't let them kick you out of the room. Anyway, all the bills start coming in. We're in our minds thinking, well, how much is this going to be, right? Because you never know. They can never publish a price. They can never tell you. They tell you these lies like,
Oh,
well, it's complicated. It depends on how we code it. It's like, that's a cop out. This doctor, this hospital has done many fractures of a tibia before. They should know exactly how long it takes, how much it costs, but they just lie to you so they can overcharge. Anyway, all the bills come in, and even though the doctor worked for the hospital and anesthesia was at the hospital, we got all these bills, separate bills from the hospital doctor's office, and all that. So we got 5 or 6 different bills over the period of 3 or 4 months. You know, it takes some months to get all the stuff figured out. That's how inefficient they are. All the bills racked up, and it was $48,000. Okay,
For a very standard, not that a compound fracture doesn't take work, it does. The surgeon did his job, but very healthy young kid. The only reason we were there is that long is we had to wait for the surgical suite. It was during COVID, so there was a whole lot of hassle with that. And then we had to wait for him to be cleared to leave. So, you know, had everything been more efficient, we probably would have been there maybe 8 hours, if less, and not less. And then the patient, you know, my son was super healthy, so there was no complications. So if this is something an orthopedic surgeon does very often, it should have just been an in and out type of situation. There was no, you know, complications of health causing it to be harder than normal. And so, you know, take that out of the picture. If you do a procedure multiple times throughout the year, which orthopedic surgeons do, it's a standard procedure. It's not as complicated as what
right.
they're saying. And the medications were very slight. I mean, obviously, we had to make sure that he didn't have an infection after being in the irrigation canal, you know, moderate pain coverage because of the bone fracture. But it wasn't like this was a huge trauma. I mean, yes, it was trauma, but it wasn't like excessive. So, that being said, when you start comparing prices and somebody says this is very complicated, unfortunately, when we started going to the surgical center to ask them what they would charge in Oklahoma.
So at our local hospital here in Moses Lake, Washington, Samaritan Hospital, a public government hospital that uses our tax dollars, um, it was $48,000. Okay, I think that's ridiculous. I thought about that right away. So I called my good friend, Dr. Keith Smith, who is the co-founder of Surgery Center of Oklahoma. And they've been around for over 25 years now. And they're transparent pricing. You can look them up on the internet. They will tell you what it costs to get a hip done, to get a total knee done, to get a, you know, XYZ surgery. They will tell you what it costs. And that's all inclusive. No
Up
surprise
front,
up front, no
no
surprise bills,
surprises.
right? So guess what the bill was? It was like $8,000. Okay. Now you could say that's a chunk of change, and $8,000 is a chunk of change. You bet you it is. But think about this. It was 6 times less expensive than the insurance price. Now I get it that the hospital didn't get paid $48,000, but that's what
With
they
normal
charged me.
insurance.
That's what they charged me because we don't have regular insurance. We have a health sharing ministry. That's what they charged me. Okay. And one of their arguments was that, oh well, if they're doing it that cheap, then it must not be it must be low quality. That is a bunch of crap. In fact, you could argue it's better quality. Why? Because if an individual consumer goes to the Surgical Center of Oklahoma and has a bad experience, they won't get business. At Samaritan Hospital or any hospital that bills insurance, Premier Blue Cross, Medicare, Medicaid, whatever, they're preferred providers for those insurance companies. The individual consumer's complaint does not matter. It does not matter at all. In fact, look at most hospitals. They will have bad reviews from bad patient experiences, yet they still get patients because all they do is they get preferred provider status from the insurance companies. They don't need to care about the patient. And I'm sorry if I'm beating up on anybody that works at hospitals. I'm not beating up on you personally as a doctor, as a nurse, or as a pharmacist. I can just tell you these are just the facts. Insurance
Well,
billing makes things more expensive because it's non-transparent.
even in our son's situation, the surgeon, the PA, the nurse, they did an excellent job. I'm not complaining about that at all. But if you are a surgeon, if you're a doctor or a nurse, and you are raping people on cost of goods or cost of service, you're still you're still breaking your Hippocratic oath. Because what people don't realize is even in our situation, it isn't just people that have a health sharing ministry or don't have insurance. It's people with insurance who still end up going bankrupt in the United States for the services that they are being provided. And the difference of quality is night and day. It's not just the experience of having the service done. It's also what happens in the billing department, because as we go along with the story, it gets even better.
Yeah, it's unethical. And if you're in that system, I'm just saying it. I mean, you're an accessory to the
You
crime.
are.
That's just a fact. Dr. Keith Smith, I'm quoting him from that. I used to protect my colleagues, saying they had no choice, but you do have a choice. Um, and so here's how it gets better. So first of all, let's think about your average person that has a 20% copay. What's 20% on $48,000? It's over $9,000.
Right.
I would have been better to pay cash at the Surgery Center of Oklahoma. Those are facts. This happens all the time. We could give multiple examples of this, whether it be an MRI, whether it be an ultrasound, whether it be, um, a total knee surgery. These are just facts. If you go up front and pay upfront minus insurance, without insurance interference, you will get better quality, better service, and less price. And I can say this, it's just like, if you gravitate towards a provider that doesn't bill insurance, all those things come into play.
Well, let's even take on a simpler scale versus a surgery or trauma. Even labs, for example, if you need to have labs drawn, if you paid cash for them versus your copay, give that example.
Yeah, there's like, Jan and I specialize in hormones, and typically our providers will order, a complete metabolic panel along with a hormone panel. And if they pay cash, it's about $100. If they go, depending on where they go, if they go through their insurance to a lab that bills their insurance, they bill their insurance, it's anywhere from 800 to $1,200, even upwards of that. So guess what? If it's rejected because it wasn't covered because it needed prior authorization or whatever reason they used for rejection, then you're out $1,000. You would have been much better off to pay the 100, or let's say it is covered, and they cover the $1,000. Well, they're going to make you pay 20%. You're going to pay 200. You're going to pay more over the long run for any type of elective healthcare, and most all healthcare outside of true emergencies is elective. Um, I would not go through insurance.
So let's also talk about, we're talking about the finances of it, which is really important. But what about whether it's really standard of care or quality of care? How many times your provider makes a decision as to what step needs to be taken next for your health isn't really determined about maybe their skill set or what they think should happen. It's determined by what their insurance company is requiring something to happen before the next step. So why pay for procedures that no, need to be done if we can just jump to what needs to be taken care of today? I mean, we don't even see that picture play out. So can you think of some examples of like x-rays or
Well, a
scans
good
or
example would be ultrasounds for women and breast cancer. There's a lot of women that are privy to the fact that mammograms are not good. Mammograms do not prevent breast cancer. They give you a lot of false positives. They put fear into a lot of people. There's a lot of biopsies that have been done, maybe even mastectomies that have been done because of false positives on mammograms. And mammograms give out radiation. So a lot of women are electing to just have an ultrasound, and they want to do that first. But in the insurance model, they make you do a mammogram first. And if it shows a positive, they make you do a biopsy first. This is the insurance company making the call. So when you go through a doctor that bills insurance, this is what happens. Um, Before you can do that ultrasound. Well, guess what? You can do an ultrasound cash for like $200. So why wouldn't you just elect to do that instead of going through this runaround? I can give multiple examples of this with MRIs. MRIs take 3 or 4 months to get a prior authorization.
Well,
the insurance pays $5,000, you owe $1,000, or you could do one cash and get it done tomorrow for $500.
I'll just give you an experience for myself. So, when's the last time a provider said for an overall well check, let's do a physical exam? Why aren't we doing breast exams and a physical exam of the breast in the office before we send them out to do all these other tests? Why would we do all this other stuff,
Mm.
right? And many times, and this is just my experience, many times we can do the labs, we can check off all the things that are on their box to check so they can bill insurance, but they never do the physical exam. Folks, a physical exam is something that should be very basic. Physicians, nurse practitioners, and PAs should do physical exams before they jump into this other arena. You're lucky now if you're in the office, if you're there for 10 or 15 minutes, even that somebody even checked your blood pressure correctly, or
Or
listened to your
touched
heart,
you.
or even touched you, or even looked at your skin if you went in for a procedure or to be examined. An examination is something that's still a priority. So if we want to go down the rabbit hole of just insurance, why didn't we avoid all this other stuff if we didn't even do an exam first?
It's all about money. I mean, labs make money. X-rays, imaging makes money. So most all diseases can be caught. 80% of all of them can be caught with a good physical exam and history. Yet that's not what we do. We always give labs and imaging, and maybe that is confirmation, but lots of times it's not anymore. And that's the sad part. Stay tuned to have to watch Dr. Jen Simmons. We're having her on our podcast either next month or in October. And she is a breast cancer surgeon that talks about how many false positives mammograms
Yep.
give, and how she doesn't recommend mammograms, and how we've done so many unnecessary biopsies and mastectomies with breast cancer, and it's all about making money. It's
Okay.
good that we're seeing people speak the truth now. I mean, a former breast cancer surgeon, that speaks volumes.
Okay, let's back up to this one. When's the last time your doctor talked about what nutrition you had, what you eat, what your activities, whether you're sleeping at night? What about the basics of healthcare? I mean, that's something that, I find just amazing. You take your pet in. We had a cat that had a urinary tract infection. And the first thing we did is look at, he did an exam, looked at my cat, and then we looked at the diet. Folks, we should be on that level when we go to a physician, especially with chronic illnesses in our country. The number one problem of chronic illnesses is our lifestyle. That's the last thing that's being addressed. Why are we billing for all this insurance and all this other stuff when we're avoiding the elephant in the room? Most of the time, things can be changed with lifestyle adjustments. And it's a cop out when I hear providers say, oh, they'll never quit smoking. They'll never change their diet. They won't change their activity. That's not true.
Absolutely not true.
100% not
That's a
true.
lazy
That's why
doctor.
it's a fallacy and it's a lie, and you choose not to take the time to explain to people why their lifestyle is important and why food, diet, and exercise and reduction of stress is primary before we start jumping into procedures and chemicals and drugs.
Yeah, and here's why. Here's why we tell you that to do, if possible, stay away from health insurance. Because the health insurance companies and the drug companies collude to create a cartel to rip off consumers. Let me give you a good example. Cholesterol. For those of you that follow Janet and I, you know that statin drugs to lower cholesterol are one of the first drugs we started questioning as pharmacists. I don't believe they work at all to decrease cardiovascular disease. They are great at lowering cholesterol. I don't believe they decrease the risk of cardiovascular disease one iota. I don't care what study you show me. The studies are put out by Big Pharma. They're sponsored by Big Pharma. I don't trust the studies. I just think rationally about it. They've been out for 40 years, and cardiovascular disease is an all-time high in Americans. And yet everybody's on a statin, it seems to be. So, but here's the thing. If you go to a doctor that bills insurance, The insurance company says, okay, Dr. Joe Blow, if your patient has a cholesterol over 200, the standard of care made up by drug companies and insurance companies, the standard of care is you have to prescribe a statin. And if you have 50% of your patients, I'm making this number up. If 50% of your patients with a cholesterol over 200 are on a statin, we'll give you an extra 1% reimbursement. And that's on all their patients. It can amount to hundreds of thousands of dollars. If 85% are on a statin, because you're doing better on standards of care, we'll give you an extra 3% reimbursement. So doctors are incentivized. They're not getting direct kickbacks, but doctors are incentivized by prescribing more drugs based on the numbers that the health insurance companies give them and standard of care. Again, Jan already talked about standard of care is not quality of care.
So here's the thing. Your doctor may not even understand this
No.
because he's working for a big clinic. And it's the clinic and it's the administrators of that ownership of that part, the CEOs and all that, that keep them in check. So they look at people's prescribing or doctors' prescribing habits as to whether they're consistent with what is being driven by the insurance and by big pharma. They're not looking at outcomes of the quality of health of the patient. So if we look at different countries, for example, Japan is one of them, those doctors are more incentivized by healthy patients, by outcomes of the patients not coming back for chronic disease. Where in our society, what we do in the United States is, we keep coming back every, I don't know, every month, maybe more, for one issue after the other. And we keep you in the system as long as we can versus healing you. So what we really want to point out is insurance in the United States does not lend towards healing, it lends towards spending. And usually we lose in our own bank account, no matter if you have insurance. And really, honestly, the best system that is out there that's parallel to this is a cash driven system because that provider tries to keep you out of his office and as healthy as you can. And they actually are going to be more upfront because you have a direct relationship with them. Many times in the United States, we call it a direct primary care system, but there's fee for service, and there's many of them popping up, especially after COVID, where they were not happy with how they were being told how to prescribe or how to take care of their clients. So look for them. Even if you have insurance, we have one provider that's out of East Wenatchee that has many of his clients that are on Medicaid who can't even get in to see a physician, that would rather pay a fee up front every month to be able to access somebody and actually see a provider that cares.
Yeah, just because something is free doesn't mean you can access it. I mean, think about that. I mean, that's government healthcare for you. So, and also when you're looking for a DPC doctor, try to find a doctor that's a healer and not a drug dealer. So
100%.
there are some DPC doctors out there. All they want to do is just give another drug for XYZ disease, but they just don't want to go through the insurance system. So find a doctor that's trying to get you off drugs and trying to make you healthy and is not a drug dealer, but a healer. I want to go back a little bit to the story of this is what a racket the health insurance company, the health insurance system is, and the hospitals that bill them. I personally, and if you look at it through COVID, and this is nothing personal for the people that work at the hospitals, but I think hospitals are evil. If they bill government insurance, they are evil. If you look at what they did during COVID, they did all kinds of stuff to put people on ventilators, remdesivir, that harmed people, and they did it because they were following the dollars. I think that is completely evil. It wasn't because it was the best care. Our local hospital here, I got into a debate with them. I said, well, I want a cash discount. They said that they couldn't give me a cash discount because we had a health sharing ministry. Okay. And we have a health sharing program. If you look in my book is called Sickened: How the Government Ruined Healthcare and How to Fix It. We talk about health sharing programs. And we basically pay a monthly fee. Janet and I pay for our health sharing program $180 a month for both of us. And if there's a catastrophe, like my son broke his leg, it's covered. They sent me a check personally within 7 days. I had a check personally. and then I had to pay the hospital. So the hospital lobby in Washington State lobbied to make it where if consumers had a health sharing program, it was illegal for hospitals to give them a discount. That's how evil the hospital industry is, because they knew what was happening in other states and in Washington. It's like, well, I want a cash discount. And I mean, they were literally, if you, we had a podcast episode with a doctor down in California, which is a DPC doctor. I'm sorry, in Arizona, and his patient had a heart attack. It was a $300,000 bill. He had a health sharing ministry. They wrote off $250,000, and the health sharing ministry had to pay $50,000. And I mean, the reason they wrote that off, because not because they're not making money. That's what the price should have been in the first place. Okay, I don't feel a bit sorry for the hospitals at all. I don't feel a bit sorry for anybody that overcharges by tenfold, and then when they get the real price, they're unhappy.
Well, they don't expect it anyway.
No, they're right, because
They
they don't get it from Medicare. They
it
don't get it from Medicaid.
right.
Why should they get it from the individual consumer? Because it's a ripoff. So they couldn't give me a discount. Well, first of all, I argued to get a detailed billing statement. And I mean, it was like pulling teeth. They're like, well, why do you want a billing statement? Seriously? I mean, imagine
What?
checking into a hotel
Or
and saying you want an itemized bill when you check out, and they tell you no.
or
That's how
even
evil
going
these
to the
people are. Or
store.
yeah, we want transparent pricing. That's not what hospitals do if they're billing government insurance. So that was a nightmare. I worked with him for months. In the meantime, my health sharing ministry is wanting to pay the bill. I'm like, let me get all this settled first. I called the CFO, and he talked to me, and he was trying to make excuses that it's a healthcare problem. And I'm like, well, let's start fixing it right now at Samaritan Hospital in Moses Lake. Their marketing director called me up, basically told me that I was, spreading slander about them. And I was just spreading facts. I'm like, you can come on my podcast and let's talk about this pricing issue. They refuse to, because they know they're hiding. They're hiding because they are ripping people off, and they know it. Finally, the CFO says, I'm going to give you a 20% discount, and I'm doing you a favor. Thank you for being so nice to me. I thank you so much, hospital. They gave me 20% discount. It went from like 48,000 to 35,000, something like that. And I said, what's the longest I can pay the bill off and not pay any interest? They said 12 months. You can pay 12 months interest free. So it's like $3,500 a month or something. After I got the check from Samaritan Ministries, they found out about, or actually from
They
Christian
knew that.
Ministries. Yeah, I got the check. They tried to send my son to collection because we got all the money already, even though they had already set up a payment program for me. That's how evil they are. And then they called me and said, it's not fair that you get this money and you don't give it to us. I'm like, am I not holding up to my end of the bargain that you agreed to? Yet they can overcharge you eightfold, and they can look you in the eye and say that's okay. That's how evil the system is. That's why at this podcast and in my book, we want to educate and empower individuals to take charge of their own health. First of all, so you don't need the system. That's the first and foremost. So you only need it for emergencies, like when my son broke his leg.
Right. And if you do, ask them for prices. Your physician office should be able to tell you how much they're going to charge,
And if they
even if
can't,
it's
leave.
right. I mean, it shouldn't be that hard. And if people are giving us that big of a racket about somebody, or asking the question, find somebody who's willing to be upfront and talk about it. Because, honestly, if we didn't have, and I'm going to say this because I'm sure this really upsets them, get people out of healthcare who are just taking a salary or a fee that have no business there. CEOs, CFOs, all these people that are at a small hospital or even a big hospital has outnumbered your providers. I
Yeah.
mean, doctors are not in charge of these places anymore, which in my opinion, that's the problem.
Yeah.
They are dictating care to us and prices that we need to change. That's why we're so passionate about places like the Surgical Center of Oklahoma, is because they are in charge. The MDs are in charge of the facility that they own. That's why they can be transparent. That's why they can look you in the eye and say it'll be XYZ price, no surprises. And they're popping up throughout the whole United States. In our local area, we have Veritas out of Moscow, and they're in Coeur d'Alene as well. They give you a
Idaho.
price, right? They give you a price up front. And I'm sure there's many places that are coming along. DPT doctors that are
DPC.
DPC doctors that are direct primary care, whether they claim that or not, fee for service. There's people out there that are actually doing a wonderful job. And I'm not saying that your doctor in your clinic doesn't care, but their hands are tied. And if they want to get out of the racket, they have to walk away and do it differently, because harming people by forcing us to do procedures that cost money that are not really required, giving us drugs and pharmaceuticals that are not healing us. Yes, there's a time and place for a drug. You have an infection, you have a surgery, you have a crisis. Yes, but chronic diseases need to be healed in a different way. And we need to get out of that place. And that really is by saying no to the system, healing yourself, finding the people that are going to listen to you. And Sean Baker, which is somebody from the carnivore world that Shawn and I support wholeheartedly, he says, ask yourself, is your doctor a drug dealer or is he a healer? And we have to keep asking that, because if they're a healer, they're also not going to rape our pocketbooks.
Yeah, exactly. And and when they're dealing with you directly as a patient and including the payment, they got to look you in the eye. Just like at our pharmacy, at Mosaic Professional Pharmacy, we got to look our patients in the eye when we charge them something. So we want to make sure it has quality, value, good price, and good service. If somebody else is paying the bill, the price does not matter. Actually, service doesn't either, or quality, just like I discussed earlier. And in my book, Sickened, How the Government Ruined Healthcare, check it out. It's the #1 seller on Amazon. In chapter 6, there's a 6-step solution. And at the very top of that chapter, I write in there that the best health insurance we have, it's not some policy that we can buy. It's right here.
Right.
That's the best health insurance we have.
It's
period.
what we choose to do.
Right.
Yeah.
And in that chapter, I have a 6-step solution. The first one is that consumers need to take charge of their own health. There's another step in there about doctors and clinicians need to get out of the insurance billing model. I mean, that's just fact. Stop playing the game. Okay. Hold up to your Hippocratic oath and stop playing the game. And another one is that employers need to stop paying for healthcare. You can read the story about why employers started paying for healthcare in my book, but employers were never really meant to pay for healthcare. It was a thing created by the government. And do you, as an individual consumer, or an employee for that matter, do you want an employer dictating your healthcare? Seriously, that's dangerous to me. I would never want anybody besides myself dictating my healthcare. That includes an employer or the government. So if you have employer-sponsored insurance, get out of it. Talk to your employer, negotiate out of it. Negotiate a raise. You get a big raise if you can negotiate out of it. So, Janet, how do you want to end this podcast up?
So how we want to end this is just question whether your insurance company is really benefiting you or not. You don't have to take our word for it. Start your own path of researching this out and looking at it. Check into the places that are actually using cash services for their clients and see what you find. You'll be surprised. Do your own research. We say these things so you can be in charge of your own health and the decisions you make for your family and yourself. So, be in charge, but also remember you're in charge of yourself, like Shawn and I have been saying through this podcast and all of our podcasts for that matter. Be in charge of yourself. You make the biggest difference. It's you that has to make the actual changes if you are ill, or maintain the things that are keeping you healthy. Healing our bodies doesn't have to be that expensive for most of us. Most of us need to make just day-to-day decisions. It doesn't have to be that complicated. Just start looking into it and see what you find.
Yeah, and thank you for tuning into Health Solutions with Shawn and Janet Needham. We stream live on Facebook, LinkedIn, YouTube, X, Instagram now, and Rumble. We would appreciate it if you like, subscribe, share this with anybody that you think they need to see this, so they can be in charge of their own healthcare. So tune in tomorrow on our midweek podcast. It's going to be a Wednesday this week because we're traveling, 8 a.m. to 9 a.m. Pacific Standard Time. Health Solutions with Shawn and Janet Needham. Thank you.
Oh, I'm keeping it going. Yes. So we are super excited to be able to do this with you folks and help you. And if there's anything out there that you might have a question on, there's so many things on YouTube, Facebook, Instagram, you name it. So you can look at those places if you have any other concerns or questions or things that you want to learn about.